guys, happy Friday. So for today's Q&A, I thought I would address the questions that I continue to get regarding skin tags. I think a long time ago when I first started doing Q&As, I did them kind of in a potpourri fashion and I briefly addressed skin tags, but I figured now that my Q&As are more topic focused, I would do a dedicated skin tag Q&A. I don't think I covered everything that time, and you all have been asking for it. But anyways, getting to the point. If you are not familiar, skin tags are these very common little brown, tan, skin-colored growths that occur frequently on the neck, sometimes on the face they can occur, unfortunately, and they have a predilection as well for occurring in areas of the body where there's skin on skin, like in the folds, under the armpits, under the breasts, kind of in the groin area, and under the abdomen, for example. And they are otherwise benign, innocuous growths. However, they are cosmetically displeasing to those who are afflicted by them. And because they often occur in areas of friction, they can be very irritating and very aggravating to cope with. And so people want to know how to get rid of them. That's probably why you're watching this video. They're not dangerous. There are a few other benign skin growths that can kind of look like them, like viral warts, for example, or dermatosis papulosa nigra, another benign skin growth that I talked about in a previous video when they occur on the face. They are not dangerous. They, for whatever reason, one thing you should know about them is that they oftentimes are associated or seen in higher numbers in people who are either obese and or have type 2 diabetes or pre-diabetes. Now, having a lot of skin tags, there are plenty of people out there who are not obese and who do not have type 2 diabetes who have skin tags. But they do seem to be more common and more numerous in people with those in those situations. And the cause of skin tags is a mystery. We have several theories of what causes them because they tend to occur under the armpits, for example. It's thought maybe friction or irritation drives them and causes them to come out. It's also thought that insulin resistance in people with pre-diabetes and diabetes somehow drives the growth of these. That's another potential theory. Maybe there's some hormonal influences. It's not entirely known. Some people speculate it might be related to a little wart virus. These are all sort of theories and guesses. We don't know what causes them. And, as with any benign skin growth, there are a variety of ways to remove them that could be offered to you by a dermatologist, or your primary care provider may feel comfortable removing these as well. Removing them is pretty straightforward. They can be removed by a variety of common techniques, many of which I've addressed in some of my other videos. Probably one of the easiest ways, because skin tags oftentimes, as you may be aware, they oftentimes occur on like a little stalk, or they kind of dangle off of the skin. And so they can be removed just by putting some numbing medicine under the stalk and then snipping it off with a pair of surgical scissors, and then putting a little bit of cautery there to seal the base, and they'll go away. They do tend to be very, very numerous, however, so that can be very time consuming for the healthcare provider to do, but that's an option. And then, another option is the liquid freezing spray that many physicians have in their office that is used to treat warts, that is used to treat seborrheic keratoses. All of these other kind of benign skin bumps oftentimes can be treated with a liquid freezing spray. With a liquid freezing spray, there can be a little bit of a risk of hyperpigmentation developing, so it's oftentimes not used on the face. People with darker skin types are more at risk for that hyperpigmentation with the liquid freezing spray, so it's often not chosen in that situation, but can be used in other areas. Then there's electrosurgery with the little zappy tool that you often see in your physician's office that is likewise used to treat warts and a variety of other benign skin growths. And like the freezing spray, there is a little bit of a risk of hyperpigmentation afterwards. And also hypopigmentation can occur after these treatments, so loss of the pigment of the base of the skin is another potential complication. But generally that doesn't happen, and they're pretty easy to remove. It's just very time consuming. In addition to cryotherapy, snipping them off, and electrodesiccation, electrosurgery, another option is to ligate them. Many physicians will do this. They have a little central blood supply to them, and so a lot of times they can be ligated with a suture. And what that means is they tie a suture around the base of the skin tag and tie it really tight, and it sort of strangulates it, and it loses its blood supply and kind of turns crusty, and within about 10 days generally falls off. That is not my favorite approach to these because there's a lot of risk for them becoming secondarily infected, and I just find that it's a very uncomfortable way to go about this for patients. So that's not really my favorite approach, but it is something that has been reported in the literature and is oftentimes offered, but it's not really my favorite approach since they're so easy to remove with gentler one and done kind of methods rather than waiting 10 days for the thing to fall off. So, but that is another option for removing them. But many people want to know about home remedies. There are tons of home remedies touted out there on the internet and on YouTube. I mean, you can Google and find a YouTube video of somebody telling you how to take out your own pancreas. It's ridiculous. I mean, it's quite scary. It's like, why do we even go to medical school anymore? People are just DIYing their own treatments. But I do, and it is my bias as a dermatologist to say this, but I do strongly encourage you to see your healthcare provider for treatment rather than attempting to DIY any home remedies, because there are risks associated with taking these things off by yourself. Like I said, they can become secondarily infected. You can develop problems, scarring, all sorts of horrible complications could potentially occur. Now, like I said, for whatever reason, there is a high association with obesity as well as type 2 diabetes and insulin resistance with developing numerous skin tags. And these individuals, these situations are situations in which also you have poor wound healing and a tendency towards developing skin infections. Also, the skin tags tend to occur in areas of the body where there's skin on skin, and those are other areas of the body where bacteria are more likely to proliferate and cause problems. So I really caution everyone to always just take a step back from DIY home remedies and self-treatments. It can be very, very problematic, and complications can and do arise when people try and do these things themselves at home. You can go on Amazon and find there's this like tag removal kit where it basically is kind of like an at-home ligature apparatus that it almost looks like some sort of guillotine for the skin tag. People will claim that those work really well, and I've had some people actually achieve success with those, but I don't recommend them. Like I said, you can develop a skin infection, and it's very, very painful, very uncomfortable to strangulate and to ligate your own skin tag. So I don't recommend those. They're like $10 on Amazon. I mean, it makes me nervous. Some people will attempt to tie dental floss around them and, or string or something and strangulate them themselves and ligate them themselves. Again, very uncomfortable, risk of skin infections, risk of poor healing. I don't recommend doing that. Topically, they sell a lot of creams on the internet too, like gimmicky creams to dissolve them, and those are not evidence-based methods of removing skin tags. They oftentimes contain very irritating, caustic ingredients, and you don't want that in your armpit. So I do not recommend any of the at-home skin tag removal creams whatsoever. Just don't go Googling these creams, because whatever you'll find, it can be problematic. They sell at-home freezing kits. I mentioned the at-home freezing kits when I talked about warts. And, you know, those seem to be okay. They don't really cause problems. But as I said in my warts video, I have not ever seen great success with those at-home freezing kits for anything. I don't know if it's that they just don't allow a very direct application or what the deal is, but I mean, to me, I just don't find that they're helpful. But sometimes people report success, and those seem to be less risky than some of the other things. Then everybody is a fan of putting tea tree oil on everything. I mean, tea tree oil, people want to put it all over everything, their hair, their scalp, their nose. I mean, it's like enough with the tea tree oil, okay? One thing you should know about tea tree oil, A, it's not evidence-based for skin tag removal. B, it is associated with a very, very high rate of irritant and allergic contact dermatitis and chemical burns that can be quite horrific. Tea tree oil contains compounds called terpenes. It can degrade upon exposure to light. I really just caution you to take a step back from the tea tree oil. Yes, it is present in a lot of kind of natural acne remedies and scalp shampoos, but at home, application of concentrated tea tree oil, oh gosh, that I have definitely seen cases of bad chemical burns and bad reactions to. So do not do the tea tree oil thing, please. I mean, you can try it, but don't say I didn't warn you. And likewise, apple cider vinegar. People want to bathe in apple cider vinegar. I mean, they are touting it as a remedy for everything out there. I mean, are you in debt? Drink apple cider vinegar. All of a sudden your credit rating will improve. It's like, enough with the apple cider vinegar. It's not that evidence-based for really anything, namely skin conditions and the application of apple cider vinegar for skin conditions. There are numerous case reports of irritant chemical burns from at-home application of apple cider vinegar to the skin. So I never recommend or encourage you to go doing these apple cider vinegar masks, treatments, whatever you're reading about on the internet. Not evidence-based, can be problematic. Iodine, likewise, is another thing that people will try and put on skin tags. Iodine is very caustic, it's very irritating. You definitely don't want to put it on your face. If you have these on your face, go out in the sun, it can cause quite a bit of irritation. So I don't recommend that at all. And lastly, do not try and cut them off yourself. That definitely can cause problems. They can bleed quite a bit, all sorts of things that can complicate an at-home botched surgery. So I think it's very frustrating though if you are coping with these, because it is considered cosmetic to remove them, so it's oftentimes not covered by insurance. It can be very costly to remove them, and like I said, sometimes people will just have a ton of them, and it's very time consuming. So sometimes dermatologists, for example, will kind of say, well, given that we have only this much time in today's visit, I can take off the 10 that bother you the most, but you really want them all gone, right? Let's be honest, you want them all gone. The other thing that you should know, like I said with the dermatosis papulosis nigra, this is kind of a similar prognosis. Removing the skin tags will get rid of the existing skin tag. However, the skin tag can come back, and removing the skin tags does not prevent you from getting more down the road. So it can be this path of chasing removal that is very, very frustrating to go through, very frustrating to cope with. So kind of reconcile yourself with the idea that you may not be able to reasonably remove all of them, and try and come to some sort of decision of what works best for you, of how many you might feel comfortable removing and would make you feel better. Like I say in all of my videos, just because something is considered cosmetic and not covered by insurance does not mean that it is not important. Does not mean that it does not have a profound impact on your emotional well-being. So do not sell yourself short of that. Having these can really make you feel poorly about yourself, affect your self-esteem. They're occurring on the face, and they can be very irritating and sometimes become inflamed. So those are the most frequently asked questions that you all tend to pitch towards me with regards to skin tags. I hope this video was helpful in kind of addressing what they are and what treatments there are, and hopefully encouraging you not to attempt to remove them yourselves. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe.